A 43-year-old African-American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which outcome criterion should the nurse use? Correct answer is D. Capillary refill of less than 3 seconds. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? Correct answer is D. Semi-Fowler's position with legs extended. A 25-year-old male is admitted in sickle cell crisis. Which nursing intervention is the highest priority? Correct answer is B. Encourage oral fluid intake of at least 200 milliliters per hour. Which food should the nurse encourage the client in sickle cell crisis to eat? Correct answer is C. Popsicle. A client complains of nausea and cannot tolerate oral medications. Which route should the nurse use for antiemetic administration? Correct answer is C. Intramuscular, IM. A client with left-sided heart failure reports shortness of breath when lying flat. This symptom is called. Correct answer is B. Orthopnea. Which assessment finding best indicates worsening left-sided heart failure? Correct answer is C. Crackles in the lungs. A client with heart failure is prescribed furosemide. Which laboratory value must be monitored closely? Correct answer is B. Potassium. A postoperative client needs assistance ambulating for the first time. What is the nurse's priority? Correct answer is B. Assess orthostatic vital signs before ambulation. Which medication decreases both preload and afterload in heart failure? Correct answer is C. Nitroglycerin. A client has diarrhea and is becoming weak and dizzy. Which lab value should the nurse check immediately? Correct answer is C. Serum potassium. Which cardiac rhythm requires immediate defibrillation? Correct answer is C. Ventricular fibrillation. A client has atrial fibrillation. Which complication is the nurse most concerned about? Correct answer is B. Stroke. Which medication is used to slow the ventricular rate in atrial fibrillation? Correct answer is B. Digoxin. A client taking digoxin reports nausea and visual halos. What is the nurse's priority action? Correct answer is B. Check serum digoxin level. Which potassium level increases the risk of digoxin toxicity? Correct answer is C. 3.1 milliequivalents/L. Which ECG finding indicates myocardial ischemia? Correct answer is B. ST depression. A client with chest pain receives nitroglycerin. Which finding shows the drug is effective? Correct answer is B. Chest pain relief. Which condition causes ST segment elevation? Correct answer is B. Myocardial infarction. A client has ventricular tachycardia with a pulse and hypotension. What is the priority intervention? Correct answer is B. Synchronized cardioversion. Which drug class reduces mortality in heart failure? Correct answer is B. ACE inhibitors. A client with right-sided heart failure is most likely to have. Correct answer is C. Peripheral edema. A client taking beta blockers should be closely monitored for. Correct answer is C. Bradycardia. Which hemodynamic parameter best reflects preload? Correct answer is C. Central venous pressure. A low ejection fraction indicates. Correct answer is B. Decreased myocardial contractility. A client with heart failure gains 3 kilograms, 6.6 pounds in 48 hours. This suggests. Correct answer is B. Fluid retention. A client with dysphagia requires feeding. Which action reduces aspiration risk? Correct answer is B. Place the client in high Fowler's position during feeding and 30 minutes after. A client on spironolactone must have which lab value monitored closely? Correct answer is B. Potassium. Which finding suggests cardiogenic shock? Correct answer is C. Hypotension with pulmonary crackles. A client on bed rest has sudden shortness of breath and pleuritic chest pain. What is the nurse's priority action? Correct answer is B. Apply oxygen and notify the provider. Which medication reduces afterload in heart failure? Correct answer is A. ACE inhibitors. A client receiving nitroglycerin reports headache. What should the nurse do? Correct answer is C. Reassure the client. Which rhythm is commonly associated with digoxin toxicity? Correct answer is C. Ventricular dysrhythmias. ST elevation in leads 2, 3, and AVF indicates infarction of which area? Correct answer is C. Inferior wall. A client with urinary retention has a bladder scan showing 600 milliliters. Which action should the nurse take first? Correct answer is A. Insert a straight catheter. Which finding indicates decreased cardiac output? Correct answer is B. Urine output of 15 milliliters per hour. Which medication is contraindicated in severe heart failure? Correct answer is C. NSAIDs. A client develops sinus bradycardia with dizziness. Which drug is the most likely cause? Correct answer is B. Metoprolol. Why is fluid restriction prescribed in heart failure? Correct answer is C. Decrease preload. Which finding suggests acute pericardial tamponade? Correct answer is C. Jugular venous distension. A nasogastric suction tube becomes clogged. What is the nurse's first action? Correct answer is A. Irrigate per protocol. Which lab value is most important to monitor in a client receiving heparin? Correct answer is B. Platelet count. Morphine is administered to a client with chest pain mainly to. Correct answer is B. Relieve anxiety and pain. Which rhythm has no P waves and a regular ventricular rate? Correct answer is C. Junctional rhythm. A client with heart failure develops pink frothy sputum. What is the priority action? Correct answer is B. Place in high Fowler's position. Which medication improves survival in systolic heart failure? Correct answer is C. Beta blockers. Increased afterload will result in. Correct answer is B. Decreased cardiac output. Which rhythm is commonly treated with adenosine? Correct answer is C. Supraventricular tachycardia. A mean arterial pressure (MAP) of 58 mm of mercury indicates. Correct answer is C. Inadequate tissue perfusion. Which finding indicates worsening cardiac tamponade? Correct answer is B. Narrow pulse pressure. When should daily weights be measured in a heart failure client? Correct answer is A. Before breakfast. Which medication treats acute ventricular dysrhythmias? Correct answer is B. Amiodarone. Which ECG change is most associated with hyperkalemia? Correct answer is C. Tall peak T waves. Which intervention most effectively reduces preload? Correct answer is B. Diuretics. Fatigue and dyspnea in cardiomyopathy occur mainly due to. Correct answer is B. Reduced ejection fraction. Why are potassium supplements given to heart failure patients? Correct answer is A. Prevent arrhythmias. A client has vomited and reports epigastric pain. Which nursing action is the priority? Correct answer is B. Assess pain and vital signs. Chest pain due to MI is not relieved by nitroglycerin. What is the next action? Correct answer is C. Administer morphine. A client with hypertension feels faint when standing. Which action should the nurse perform first? Correct answer is D. Check orthostatic vital signs.